Only 1 in 5 of these people have visited with their local audiologist about getting their hearing evaluated. Joining us today is Dr. Sandra Romano from Sonus Hearing Center. She is very passionate about helping people hear because she has personally experienced the difficulties of hearing loss, and we're going to get to that in a moment. Welcome to the show.
Thanks for having me.
Let's talk about what are the consequences of untreated hearing loss.
I guess first and foremost, when you have hearing loss, you tend to isolate yourself. You may have depression or anxiety. Studies have shown that there is a correlation between untreated hearing loss and dementia and memory loss.
Wow.
You have more risk of falling. Hearing care is overall health care, so it affects the entire body.
People probably think, myself included, oh, it's only old people have hearing loss, and it's only when you get older that you have to worry about that.
Right. As we age, of course, yes, we do lose some hearing, but if you've had a history of ear infections as a child, if you are exposed to loud levels of sound, like a police officer or even a leaf blower, people with diabetes are twice as likely to have hearing loss. People with cardiovascular issues. It isn't only an age thing.
And at what age do people start? I mean, are there 20-year-olds that could be suffering from hearing loss?
There definitely are 20-year-olds, but we say, and the gold standard is, when you are 50 years of age or older, get a baseline hearing test.
Okay.
And of course, if you're experiencing difficulty before that, don't hesitate.
Okay. So what are the top indicators that you may be suffering from hearing loss?
Withdrawal from social activity, having to ask people for repetition, saying huh or what, or maybe cupping your ear, turning the TV up too loud, having difficulty hearing on the telephone, and a lot of times you don't even realize you have hearing loss. It's your family members that realize. And this hearing loss doesn't happen overnight. If it did happen overnight, you would be on the phone immediately, oh my gosh, something has happened. But it's a gradual process, so people don't even recognize that's the importance of getting a baseline hearing test.
I just had coworkers tell me today, like, why are you talking so loud? And like, I had no idea that I was. So what is a baseline hearing test, and what does that entail, and how do people go through that process?
You find a doctor of audiology that you can trust. That is the licensed professional who has been trained in hearing disorders. I've been doing it for 30 years. You come in, you have a thorough case history taken, you discuss your lifestyle and the difficulties that you're having. Then you're put into a sound-treated booth where your hearing is tested. The results are explained to you, and if you have a hearing loss and if you have a need for hearing aids, then that's the next step.
Well, and you brought some examples of hearing aids here this morning, and you know, again, people probably always think, I'm not going to wear a big clunky hearing aid around, but you have 2 hearing aids in right now, no one would know.
I do. My hearing aids look similar to this, so they're very discreet. You cannot see them. I don't know if anybody can see.
No.
There is a wire here. There's all different sizes, all different shapes, and it really depends on your hearing loss. But this is the most popular model because it is so discreet and it fits most hearing losses.
So now you cannot reverse hearing loss, but you can stop it? Or
I always say only the good Lord above knows how your hearing loss is going to progress. If it is a sensory neural hearing loss, and that's what most of us have as we age, that's what I have, it cannot be reversed. There's hair cells in the inner ear, they're damaged, and once they're damaged, they cannot regenerate. So it's not reversible, but when you get hearing aids can be reprogrammed as your hearing changes. So you don't have to get a new hearing aid because your hearing changed.
Okay, for people that are watching right now, over 50 years old, haven't had a baseline test yet, what's your message to them right now if they've been experiencing the signs of, what'd you say? Asking to repeat and all those things we went through earlier.
Call your local doctor of audiology, get a test, and if you are found to have hearing loss, do something about it. You want to prevent the negative effects that hearing loss has on your whole body, dementia, risk of falling,
right,
social isolation, anxiety, depression.
Well, I can't think of a better person to call, someone that is actually going through it. So how can people get a hold of you?
You can call my office. I'm located at 2500 Wilson Boulevard right here in Arlington, 703-525-1898, Arlington Hearing Center.
Dr. Sandra Romano, great to meet you. Thank you
Hey,
so much
for
all the
having
great
me.
information as well. And we're going to have more of Let's Talk Live right after the break, so stay with us.